So I think Nidhi, we can start, and I think as proposed, we can have a brief introduction who are there in the current forum right now, so that Dr. Sudarshan also knows about like who all have joined. So you can start, Nidhi and Saurav. So we have Dr. Vandana Shah, Ms. Vandana Shah also. Good morning, good evening, Vandana ji. Good.
Yes, it's very early in the morning. Not
I
actually
know,
very
I know
early.
it's.
No, it's 7:30.
I know, and thank you.
It's not actually very early.
Very much for joining.
Yeah.
I know it's too early for you.
No, not at all. Not too early at all.
Good evening, Dr. Arit. Okay, so Nidhi.
Yes, sir.
Yeah.
Yes, thank you, sir. A project is complete when it starts working for you, rather than you working for it. Hello, salam, namaste, sat sri akal, and greetings to all. It is a very proud moment for the Department of Community Medicine and School of Public Health, Postgraduate Institute of Medical Education and Research, Chandigarh, to have successfully implemented and completed phase 2 of the project entitled Strengthening Management of Hypertension Services through Capacity Building, Media and Communication, and Stakeholder Engagement in the state of Punjab, in partnership with Strategic Institute of Public Health Education and Research, Chandigarh, and Global Health Advocacy Incubator, USA. Today, we would be sharing the one-year experience of politico-administrative and media advocacy, which was carried out for strengthening hypertension control program in a northern state of India, that is Punjab. I, Dr. Nidhi Jaswal, along with my co-host, Mr. Saurabh Sharma, welcome all the present honorable guests, dignitaries, experts, and stakeholders who associated and stuck with us through thick and thin to make this project a success. This National Dissemination Workshop has been planned to disseminate the key achievements, learnings, and releasing the key outputs of the project. So, Saurabh, let us take the learned community to the journey of advocacy, planning, innovation, and research.
Sure, Dr. Nidhi. Without further delay, I would like to invite Dr. Nidhi Jaswal, Project Coordinator and Technical Officer, Hypertension Project in the SMHSP Project, to give a brief introduction of the project. She is PhD in psychology and has over 15 years of experience in the health sector. She previously served as a senior demonstrator for health promotion in Department of Community Medicine and School of Public Health, PGI, Chandigarh, and taught health promotion and social sciences to the MPH and B.
ਤੁਸੀਂ ਮੈਨੂੰ ਲਿੰਕ ਭੇਜਿਆ ਲਿੰਕ ਤੋਂ ਮੈਨੂੰ ਜੁੜ ਨਹੀਂ ਰਿਹਾ ਕਿਉਂਕਿ ਮੇਰੇ
Saurav, you are muted.
ਮੋਬਾਈਲ ਦੇ ਉੱਤੇ ਤਾਂ ਮੇਰੇ
Saurav, you are muted, and maybe I think we can have an introduction.
Sure, Dr. Nidhi. Without further delay, I would like to invite Dr. Nidhi Jaswal, the Project Coordinator and Technical Officer, Hypertension Project in the SMHSP Project, to give a brief introduction of the project. She is PhD in psychology and has over 15 years of experience of working in the health sector. She previously served as a senior demonstrator for health promotion in Department of Community Medicine and School of Public Health, PGI, Chandigarh, and taught health promotion and social sciences to the MPH and BPH students. Published over 35 research publications in international and national journals. Certified Master Trainer for Adolescent Health by Ministry of Health and Family Welfare, New Delhi, and has organized over 50 stress management and laughter yoga sessions.
Thank you, Saurabh, for such a generous introduction. Now, before I introduce a project with you, please allow me to brief you about our institute, PGI MER. Postgraduate Institute of Medical Education and Research, Chandigarh, is an institute of national and international repute. It is an autonomous body under the Act of Parliament, Government of India, which has consistently ranked second among the 800 plus institutes for medical education in India. The mission of PGI is engraved in its logo, which reads Atar Seva Sarva Bhadra Shodj, meaning service to the community, care of the needy, and research for the good of all. Most of us in this workshop, they are aware of the fact that hypertension is directly responsible for 51% of all stroke deaths and 45% of all coronary heart diseases deaths in India. The study was carried out in the state of Punjab, a north state of India with 22 districts and having a population of nearly 28 million people. We deliberately selected Punjab as a study area as it is one of the states in India having very high prevalence of hypertension. District level health survey 4 reports an adjusted prevalence of hypertension in Punjab to be 35.7%. Against the prevalence in India is 25.3%, meaning every third adult is suffering from hypertension. The overall purpose of the project was to strengthen political institutional framework of hypertension control program in the state of Punjab through capacity building, media and communication, and stakeholders engagement for overall strengthening and longer-term sustainability of cardiovascular disease component of Health Ministry's National Program for Control of Cardiovascular Diseases, Cancer, and Stroke. The key objectives of the project were to strengthen political, bureaucratic, and programmatic implementation of hypertension services with an emphasis on streamlining hypertension drugs procurement and logistics in Punjab in close coordination with the State Health Mission and Director Health Services Punjab. Also to provide technical support to enhance funding and human resource development for state health and wellness centers to support hypertension detection, management, and telemedicine activities in the state of Punjab. Strengthen implementation of national transport regulations in Punjab in association with FDA Punjab. Implement a comprehensive media strategy to prioritize hypertension diagnosis and treatment in Punjab through sustained earned media, press releases, research-led evidence, and human-centered stories. The project was based on 4 strong pillars, namely advocacy, implementation and capacity building, media engagement, and research. For advocacy, media mapping and engagement of elected representatives and bureaucratic ranks at the district and state level was done to place hypertension on priority list of the state government. Along with this, sensitization meetings with the Food and Drug Administration Punjab were held to strengthen transfat regulation surveillance in the state of Punjab. Technical support was provided to strengthen health and wellness centers of Punjab. The project strengthened primary care services, including screening of hypertension and diabetes through these health and wellness centers. Wi-Fi dongles were provided to enhance the internet connectivity and transfat regulation at the state and district level. Efforts were made to engage media to support hypertension services by assigning priority to the cause of overall cardiovascular health. In addition to the political and media advocacy, the project also focused on creating research-based evidence on hypertension and cardiovascular health. Now, I take this opportunity to welcome our leader, Dr. Sonu Goyal, Principal Investigator of the project, to brief the audience regarding the key outcomes of the project. Dr. Sonu Goyal has 18 years of rich experience in public health and health management. He is a professor in the Department of Community Medicine and School of Public Health, PGI, Chandigarh, alumnus of Johns Hopkins School of Public Health, Baltimore, US, and PhD from Maastricht University, Netherlands. He is a program director for International Public Health Management Development Program sponsored by Ministry of External Affairs, Government of India. He is also functioning as adjuncted clinical associate professor, Public Health Master's Program, School of Medicine and Health Research Institute, University of Limerick, Ireland, and honorary professor, Faculty of Human and Health Sciences, Swansea University, United Kingdom. We welcome you, sir. And I request you to kindly brief the audience regarding the key outcomes of the project.
Yeah, thank you, Nidhi. And I think before we start, as Dr. Sudarshan has told, so we can have a brief round of introduction because many of us doesn't know others. So I'd like to invite people right from the screen, from where they are visible. I'll start with Dr. Sandeep Singh. Sir,
Dr. Sandeep, you
unmute
may
yourself.
unmute, please.
Yeah, good evening, everyone. I'm Dr. Sandeep. I'm State Nodal Officer for NPCDCS program, and as well as I'm looking after the, as such, I'm Assistant Director in the Directorate of Health and Family Welfare, Government of Punjab. And I have a background of 25 years of field experience, primarily working in primary health care and secondary health care in Punjab. I'm a chemist by my specialty, and currently I'm a fellow of NI Chennai, and that's it. Thank you.
Thank you, Dr. Sandeep. And Dr. Sandeep has been working with us not only in non-communicable disease control program, but has been associated with us in tobacco control program and strengthening tobacco control program in the state of Punjab. So welcome, Dr. Sandeep.
Thank you.
Now, Dr. Rakesh Gupta.
Yeah, good evening all. I'm Dr. Rakesh Gupta. So I'm president of Cypher. So we are collaborating with the PGI in this project. And so I think Dr. Sonu's team and Dr. Sonu Goyal and his team, they've done a commendable job. So thank you.
So thank you, Dr. Rakesh. And I have been associated with Dr. Rakesh since 2010, when we actually started the momentum of National Tobacco Control Program in the state. And since then, I think it has achieved great heights. And in 2016, WHO awarded Punjab, state of Punjab, as the best state in tobacco control. So it was conferred WHO award at that point of time when Dr. Rakesh was nodal officer. So thank you, sir. Welcome.
Thank you.
Miss Vandana Shah.
So hello, everyone. This is Vandana Shah, and I'm the Regional South Asia Director for the Global Health Advocacy Incubator. And it's a real honor and privilege to be with all of you and with the PGIMR and Punjab government team to celebrate the achievements of this partnership.
Thank you. I think we had started association with the Global Health Advocacy Incubator 2 years back. So back-to-back 2 projects, and I think there was many achievement than what we thought of. So it was a good collaboration between GHAI and PGI along with Cypher. So it was a mixed combination between NGO, government partner, Punjab government, and even the central government. So thank you, Vandana Shahji. I think thank you for coming here at the early morning. Arun Verma ji.
Yeah, thank you, Dr. Sonu. Good evening to all. I am Arun Verma. I am a Director Finance and Operations working in Cypher. I am an engineer by profession, retired as a Managing Director for Electricity Corporation from Haryana, as well as Director from the Punjab. I have been associated now for the last 3 years with Dr. Sonu Goyal and his team. We have been a part of so many consultations, especially on the tobacco control. Wish you all the very best for today's program.
Thank you, Arunji. We have Dr. Arit Kaur.
Hello, greetings everyone. I am Arit. I am presently Director, National Health Mission Punjab and Health Wellness Center Program of Punjab. I worked with the program. I have also worked with the tobacco control program in the past, and also blindness control program. And I'm privileged to be here today, whether evening or morning. So that's me. Thank you.
Dr. Arit, again, like Dr. Rakesh, Dr. Arit has been associated with us right from, I think, strengthening tobacco control program, then health and wellness centers. We work quite a lot for strengthening health and wellness centers. And also, I think in whatever capacity, Dr. Arit has been always with us So thank you, Dr. Arit, for joining.
And thank you, Dr. Reed,
Sudarshan
especially
Mandal.
because she is also joining from abroad. I think she's in US or Canada.
No. I'm
Yeah,
here.
come back.
And I'm here. Yes, and I'm.
Achha, you have
joining
returned.
from
Okay,
India.
thank you.
Yes.
Thank you.
Okay,
Thank you.
okay.
Thank you.
Yes, Dr. Sudarshan Mandal.
Yeah, I am now, thank you, Dr. Dr. Goel. I am now working as Deputy Director General, looking after two big portfolios. I can call it big portfolios. One is that public health, international health, and another one, NP CDCS, means NCD. So, and I have joined in the Directorate of Health Services here, Minister of Health and Family Welfare, on 24th November, but I took the charge of these two portfolio 1 month later. And before that, I was working as additional DDG, and also in the capacity of DDG also in the Central TB Division in the program of NTP, National Tuberculosis Elimination Program. And before that, I was working in All India Institute of Hygiene and Public Health in different capacities, and mainly as a teacher in the Department of Community Medicine, and also as an administrator in the capacity of additional director. So that's all. What to
thank you. Thank you, Dr. Sudarshan, for joining. And I think I just made a call because I was not aware about Dr. Sudarshan has joined. So it was Dr. Swasti Charan who told me that Dr. Sudarshan has joined as DDG. So I called him and he was so generous that he immediately accepted this offer to be a part of this workshop and learn about the outcome of this important collaborative venture. Thank you, sir. And we would like to work with you more on hypertension and other programs being in PGI.
Yeah, definitely looking forward to work with you.
Yeah, thank you. Thank you. Mr. Sanjay Pandey. Mr. Pandey, are you here with us? Okay. In the meantime,
can you hear me, Dr. Sonu?
Okay. Yeah. Yes, please. Yeah. We can hear you clearly.
Thank you so much. And it is such a wonderful collaboration, and we really enjoyed working together, and achievements are very high. So I'm Sanjay Pandey. I'm with the Global Health Advocacy Incubator, and I'm based in Delhi and support the program on the hypertension and other things. And great, Dr. Mandal, welcome to the NCPDS program.
Yeah, thank you.
Thank you, Mr. Pandey. Although we didn't interact much during this endeavor, but I have heard about your activities, your work quite a lot. So I think in future we will be interacting more on some other forums on different issues, public health issues. Ms. Lopa Ghosh.
Thank you, Dr. Goel. Greetings to all gathered here. It is indeed a great pleasure and privilege to be part of this session today. I work for Global Health Advocacy Incubator as the media lead in India. I'm also based in Delhi. Thank you.
So Ms. Lopa Ghosh has been working with us for, I think, the same time as the project initiated. And he was one of the pillars of having us interacted with media. So I was not aware about how we can interact with media, how we can. So I think I learned a lot from Ms. Lopa Ghosh on how to interact with media, what are various media things which we need to do. And right now, I think we'll be having display of the media report, in which we have almost like I think 1.5 crore rupees of media coverage, earned media coverage. It turns to be around $2 million of media coverage in a 1 year time. So I think, thank you, Ms. Ghosh, for being with us for these 2 years. Now I'd like to invite Dr. Poonam Khanna.
Greetings, everyone. I'm Dr. Poonam Khanna, Associate Professor of Nutrition from Department of Community Medicine and School of Public Health. And I was in this project because of Sonu sir. I'm thankful to him for giving me an opportunity to be a part of this very, I will say, enthusiastic and successful project. I was looking after transfat component of this project. And once again, it's a great honor for me to be on this platform with all of you. Thank you so much.
Thank you, Dr. Poonam. And I think you had been instrumental in, I think, taking trans fat to a different level. So we had in between, we had a different component, that is trans fat elimination component in the project. And it was Dr. Poonam who actually worked so hard that we could take trans fat to a different level. And we celebrated a 1 month long trans fat free Diwali, in which late Shri Milkha Singh and almost 100 people from different arena of Punjab participated. Somebody from sports, films, music. So they all participated in the trans fat free Diwali campaign for 1 month. Thank you, Dr. Poonam. We have Dr. Om Prakash Bera.
Hello, sir. Thank you. I'm privileged to be a part of this entire group. And so the project starts back in December 2009. Dr. Balbir Singh Sidhu, the ex-health minister, December 1st, we started, and till date working across 3 important projects of hypertension control, of trans fat implementation, as well as like the health and wellness centers project. So this was supported, and we got results we even didn't imagine. Right from moving the political commitment, the bureaucratic commitment, the programmatic indicators, be it the trans fat surveillance plan, which is the only surveillance plan in the country to be implemented, as well as like the overall operationalization telemedicine of health and wellness centers. And proud to say that like Punjab is the state which scored rank 1 under the leadership of Dr. Arit Kaur. So this project gives us a rainbow of achievements, as well as the project covers multiple arenas, because hypertension as a disease or as a risk factor cannot be only controlled through programmatic approach. It has to be combined through multiple aspects of nutrition control, as well as health systems building. And so this project, I would say, is a limelight project, and this project should also move into different directions, so that it becomes one of the projects in which the government also provides the support, and we take it forward in a great way. So thank you, sir. Thank you to the leadership, Dr. Goel. Thank you to Vandana sir for actually moving, for helping us to move forward, and best of luck, sir. Thank you.
So thank you, Dr. Om. And as I always say that we are proud of Punjab being our partner, I also say that I am proud of Dr. Om being my student at PGI, because he has, I think, done wonderful task initially in Union, and then in now in GHAI, I think under the dynamic leadership of Ms. Vandana Shah. So I think you are doing a great job, and it was a great collaboration with you when you come here. We discussed a lot of things, and then this entire collaboration between government, NGO, academia moved on in a different direction, in different tangent. Thank you, Om. We have Dr. Gurmandeep Singh. Dr. Gurman. Okay, in the meantime, Dr. Gurman joins. So we have our staff of the project who had worked so hard. I think Nidhi has already been introduced. So we have, Nidhi was our project coordinator. And then we have Dr. Kritika, followed by Dr. Radhika. So Dr. Kritika first.
Thank you very much. Good evening to all. I'm Dr. Kritika Upadhyay, and I have served in this project on the post of Technical Officer Monitoring Evaluation. Thank you very much.
So thank you, Dr. Kritika. Then Dr. Radhika.
Greetings, everyone. Myself, Dr. Radhika. I have worked as a technical officer in the health and wellness component of the project and providing technical support to the Health and Wellness Center program at state level. Thank you.
Right. Thank you, Dr. Radhika. I think you had been instrumental in, I think, galvanizing that support between us and the Punjab government. So thank you. So then we have Dr. Mahindra Singh. Dr. Mahindra? You can unmute yourself.
Okay. Good evening to everyone. My name is Dr. Mahindra Singh, and I am working as a technical officer for transfer and supporting the transfer surveillance in the Punjab. Yeah, thank you.
Thank you, Dr. Mahindra. I think we had two PhDs in this project. One was Dr. Nidhi and then Dr. Mahindra. So thank you. I think you had been working on the media component. You had been working on trans fat component. So I think you did a great job. And then we have Dr. Saurav, Mr. Saurav. Saurav, can you? I think you have not been introduced, huh?
Sir, I am in this project as a finance cum admin cum RCCM officer. I am looking after this website rccbh.org and the finance and admin part of the project. Thank you.
So Dr. Saurav, Mr. Saurav is instrumental in creating that website, which is a first ever resource center for cardiovascular health in this country. And I think he had put all the resource material, everything from the public domain on that website. A lot of blogs are there. So there were a lot of many things now on this website. So thank you, Saurav, for being part of this project. And then we have, I think, Anupam. Yes, Mr. Anupam, I think.
Good evening, everybody. I'm
Yes,
Dr. Anupam Patni. I am the deputy.
You are muted again.
Sorry, can you hear me?
Yes.
Yeah. Good evening, everybody. I'm Dr. Anupam Patni. I'm the Deputy Lead Cardiovascular Health with Resolve to Save Lives initiative. We are the international technical partner for the India Hypertension Control Initiative. I am based in Delhi, and I'm so happy to be listening to this webinar and the achievements that PGI has done in the last 2 years.
Thank you, Dr. Anupam. And I think I interacted with you once or twice on this NCD control paper, where you provided very useful inputs to that paper. And I think this is in the final stage now. So maybe another couple of weeks, we should be able to, I think, submit it after taking your final comments.
Okay, great. Look forward to seeing the paper in public, in a published way. Thanks so much, Dr. Sonu.
Thank you, Dr. Anupam. Then I think we have Dr. Kiranjeet Kaur and Dr. Sukhbir Singh. Dr. Kiran. Okay. Dr. Sukhbir.
Yeah, good evening, all of you. I'm Dr. Sukhbir, and I'm a medical anthropologist. Currently, I'm working in Punjab University, Chandigarh, and I'm having more than 15 years of experience in health research. Thank you.
So Dr. Sukhbir is life partner of Dr. Nidhi, actually, and he wants to see how Nidhi is comparing this entire 2 hours of conversation. So thank you, Sukhbir. And he is also associated with us in, I think he's in Punjab University, and we used to collaborate with the Department of Population Sciences because he's in Department of Population Sciences there. So thank you. I think we finished with everyone. Dr. Gurman, are you here with us? Dr. Shweta? Yes, Dr. Shweta. Dr. Gurman first.
Hanji, good evening, sir. It was wonderful working with PGI, MER, and GHI on various projects, sir, like teleconsultation, operationalization of health and wellness centers, even for trans fat-free Diwali. I congratulate you, sir, and Dr. Om also for the successful implementation of the project. Thank you, sir.
Like Dr. Om, Dr. Gurman is also an alumnus of PGI, and I am really proud of Dr. Gurman because he joined Tobacco Control Cell I think first with Dr. Rakesh Gupta, then with Dr. Arit, and then with Dr. Sandeep. And he has been, I think everybody will abide with me that he has done an excellent job in the state in galvanizing not only tobacco control, but also NCD control program. Thank you, Gurman, for being part of it.
Thank you, sir. Thank you so much.
Right. So do we have, I think we were having, okay. So I think we have completed with it. So now what I'll do is I'll briefly summarize the output of this project. Although I think as Dr. Om has told that we achieved something more than what we have expected and what we have planned. So let us go to the next slide. So I think what we did was, I think this was the first meeting when we started this project. You can see we have Health Minister of the state at that point of time, Sri Balbir Singh Sidhu, who actually inaugurated this project 2 years back. And we have CFDA at that point of time, and he was instrumental, Shri K.S. Pannuji, who was Commissioner FDA. And he took the trans fat component again to a different level. And we have all the program officers. You can see Dr. Arit is here, Dr. Rakesh Gupta is here, and we have many people from our PGI, neurologists, cardiologists. So it was a great team when we started this project, and we had a lot of discussions before we started this project. So this was the first meeting of the project. And thereafter we hold several meetings with not only with, next slide, please. We had this was the meeting which was constitution of a state level NCD committee, which was almost conceptualized, but I think it's still in papers right now. But if it is formed, it will be the first committee in the entire country where we'll be having a state level non-communicable disease committee, in which not only the people from the state, but experts from the PGI. You can see cardiologist is here. We have IMA president, who is also a cardiologist here. Neurologist is here, nephrologist. So everybody was there in that meeting. There are 2 meetings which was held, and Dr. GB Singh was there at that point of time. He was NPCDS nodal officer. So this was again in early 2020 when we hold this meeting. Next, please. So this was again a landmark achievement for this project, that there was an MOU, proper memorandum of understanding, which was signed on trans fat surveillance between FDA Punjab and PGI Chandigarh. So it was under this MOU, it was like we have done, like we wanted to do strengthening of the surveillance labs in the state of Punjab. And also under this MOU, we have started the surveillance activities, and the data collection and sampling has already been started. We are yet to analyze the samples which have come. So again, this was a great move, which was this MOU was there initially for I think 2 years, and then I think so. This was another achievement which was there. Next, please. So we had many capacity building trainings of a designated and food safety officers of Punjab. After we signed the MOU, we trained them in how to conduct surveillance. We told them the importance of surveillance, and then they started doing surveillance in their own districts. And they have collected they have started collecting samples from different units, food units in different districts of Punjab, and regularly these samples are being tested in the state. Next, please. So this was, I think, with Dr. Arit, the main anchor for this. So we could strengthen the health and wellness centers of the Punjab. We, under this project, we gave, I think, 300 plus dongles to the state, and then we the entire machinery which was started, and we have Dr. Radhika, who had been conducting trainings for the people of health and wellness centers. So there we involved them in various activities. Even in trans fat free Diwali, we kept a prize like what they can do in their small health and wellness centers. So entire, I think more than 10,000 health and wellness centers have been working, and they have been working very efficiently. So next. This, I think there were various campaigns which we can boast of in this project. One was the trans fat free Diwali campaign. You can see many singers, actors, police people, and you can see Milkha Singh ji who supported this project, and he gave us the bite for this project. And there was almost like 1,000+ activities which took place in different schools, in different health and wellness centers, and different areas. So it was quite a buzz at that point of time. A 1-month campaign was celebrated. And then you can see Yoga High BP Bye campaign, and Sadhguru ji was invited, and he also gave, I think for PGI, he told that this is a very good initiative of Yoga High BP Bye. And you can see many more alumnus. And this, our campaign was highlighted in the main function of PGI, which was celebrated on the World Yoga Day. So this was the main highlight of this was a 7 days campaign in which we do a lot of other activities in the institute level also. Next, please. I think we did many media sensitization workshops to sensitize media on this hypertension, the trans fat component, telemedicine, and we received many coverage. In the first year, we received relatively lesser coverage, but in the second year, I think the media reports will be shared after this. We received huge coverage from the media. So we built a rapport with the media now. We have almost 50+ media houses who are with us, and they want to come, I think, at any point of time when we do such sort of activities. Again, we have many workshops and seminars. You can see Dr. Swasti Charan. At the central level, we invited people. Central Academia, we invited people. We have like Professor Chandrakant Pandav, who conducted the entire webinar. And again, I think it was widely covered in the medias and media as well. Next, please. This I have already told. This is the resource center for cardiovascular health we initiated. We kept a very small component in the project, but we could galvanize this to a very high level. And we have many protocols on hypertension diagnosis, management, news article, project activities are being highlighted in this. Our blogs, we used to write blogs on hypertension, on telemedicine, and many other activities, and we post it on Resource Center for Cardiovascular Health. And now it is being seen by many people across India and some people from across globe. Next. This is another activity which we started, that we started a newsletter that is cardio health. We didn't kept it into the project, but this newsletter, which was the theme-based newsletter, and I think this every year, every 2 months, we release this newsletter, and every time the theme is different. So sometime it is trans fat free schools, digitalization of health and wellness centers, cardio health, and this eliminating trans fat, and other like universal health coverage and trans fat elimination. So every time there is a different theme on it, and we have quote from national and international personalities in this newsletter. Next, please. Can you move to the next slide, please? Again, this was a great work which we did last time, that we started an operational research component in the project. And I am happy to inform you that when we launched this operational research under the banner of PGI and GHAI, we had 100 teams from across country who applied for this operational research program. And out of that, we selected 30 teams from 30 medical colleges and institutes from across country who wrote articles on National Family Health Survey, analyzed National Family Health Survey and wrote articles. And we have 30 full articles on National Family Health Survey, which was submitted to very high impact factor journals. And I'm also happy to inform that one of the journals, PubMed Index Journal, has agreed to publish a special issue on this entire endeavor. So I think we will be told about this in detail a bit later. Next, please. These are 2 articles. I think, yes, I want to highlight. Can we move to the, yeah, just before. Okay, so just want to highlight that one of the article which was published is a development of an integrated model of communication. So that was the integrated model of communication which we developed and which we could publish in a journal of hypertension. So this was a model, this was first of its kind model in the country, which we published. And we also analyzed the impact of social media for extending outreach of hypertension services in northern states. So we did a computational study on Twitter. So we published this article as well. So now over to next, I think. Yes.
Thank you, Dr. Sonu, sir, for highlighting the key outputs of the project. Thank you, sir. Dr. Nidhi, I am pleased to inform you that we have a very special guest today.
Oh, really, Saurabh? I would love to hear about our special guest.
I feel honored to introduce our special guest of the day, Dr. Vandana Shah, Regional Director, South Asia Program for Campaign for Tobacco-Free Kids and Global Health Advocacy Incubator. Dr. Shah leads policy and program development, intervention in India, Bangladesh, Pakistan, and many other South Asian countries. Formerly, she was the Executive Director of the North Carolina Health and Wellness Trust Fund, a state foundation where she was responsible for developing and implementing state-wide public health program with annual budget exceeding $30 million. She is the co-founder of Kiran, a domestic violence organization for the South Asian in North Carolina, and has served on the board of various healthcare and non-profit organizations. We welcome you, ma'am, and request you to kindly present the GHAI perspective for the hypertension control in Punjab.
Thank you so much to the PGIMR Cypher team and the government of Punjab. I just cannot share what a special honor it is. I was there actually on a very first day that we launched this project, which was in early November of 2019. And I want to just echo that, very rarely when I'm talking at the conclusion of a project, do we say that we far achieved, overachieved from the goals that we set out for. So it's really, a very sort of momentous and exciting day. Will one of you be sharing my presentation or should I share my screen?
I will be sharing, ma'am. I will be sharing.
Right. So if, so I just wanted to say that, it's been, I think it's really momentous to mark that all of this progress was made, during COVID and the lockdown. And I think the collaboration between, PGIMR, Cypher, and the support from the government of Punjab and the partnership has really achieved not just critical outcomes for Punjab, but what we've been able to share both nationally and internationally from the work that we've done on cardiovascular health in Punjab. So if you could share my slides. So I just wanted to start out by telling you a little bit about the Global Health Advocacy Incubator. So we have been working, in India over the last 12 plus years. And our role has really been to support governments and civil society organizations accelerate adoption and implementation of public health policies, which are in line with global health practices. So our parent organization is the Campaign for Tobacco-Free Kids, which many of you have worked for, which is a leading force in tobacco control and has been working across India with all of the state governments and the central government, as well as globally as part of the Bloomberg initiative to fight tobacco use. So next slide. So globally, we work on a variety of projects. Obviously, tobacco control was sort of our original mission. And then we've started work on cardiovascular health, as well as food policy. And this is in partnership with the Resolve to Save Lives. So I want to thank and acknowledge Dr. Anupam Patni, our technical partner, who's here with us today. We are also working on child drowning prevention, civil registration, maternal reproductive health, preventing epidemics, road safety, and violence against women. And these we work in at least like nearly 70 plus low and middle income countries around the world. So you can see, much of the sort of globe that we're working in on all of these. So I want to say that the learnings and the developments on this project, which have really been truly outstanding, have been shared globally as a best practice example. Next slide. So, I just want to stop for a minute is why is cardiovascular health so critical for Punjab's continued progress? Next slide. So I think to me, what's really telling is when you look at the data from across India, where you have sort of ischemic heart disease, which is linked to both, trans fat, hypertension, really the big change in like less than 2 decades where, it went from being number 6 as sort of the leading cause for the disability adjusted life years to the leading cause. And if you really look at the state map, next slide. I think when we were looking at, where should we work in India, where should we focus our effort and resources? When we were beginning this cardiovascular health project, I think Punjab really stood out both for the burden of disease, but also for the opportunity that the leadership of PGIMR afforded us and the receptivity of the government of Punjab. So, when I came in, I had meetings with Mr. Pannu and Dr. Arit, and I was really encouraged by the openness and the desire to partner and effect change. So I think that, both there was sort of the need to make this change, but also a real there was both a need for, for a critical need to work on heart disease in Punjab, but I think we were also really encouraged by the leadership and the enthusiasm of both the government officials that I met in 2019 when we first were exploring this partnership, and the strong leadership from PGIMR Cypher. And I want to say that investment has really paid off in our partnership. Next slide. So I just want to, without sort of belaboring the point you've heard from Dr. Nidhi and Dr. Sonu, I just want to say that, some of the learnings that we've actually taken back, not just within India, but globally, and within sort of hypertension, this was really our first state where we worked intensively to really build like the politico-bureaucratic commitment. And I want to just recognize the continued leadership of Dr. Arit Kaur. I mean, I met with her right on day one when we were talking about, how we could support the strengthening and the operationalization of health and wellness centers. And she's been an incredible partner and guide in this entire journey. And, I think giving her a lot of credit for how much we have achieved. I also want to say that, and that's also just the openness and support of the entire sort of administration in terms of, building, I would say, a model drug delivery system. And I think one of the really great opportunities that came through because of COVID was sort of really accelerating and prioritizing telemedicine for both hypertension as well as overall for NCD control. On the trans fat project, I do want to say that it's been really exciting because, we again had to build, when we started work in Punjab, there was very little state level implementation going on anywhere in the country based on a survey we had conducted. So I think we really had to start from the get-go, getting buy-in from the FDA and to really focus on why it was important to implement this law. So Punjab not only became a leader in trans fat implementation with the creation and certification of the first state state level lab, the capacity building of food safety officers. I think the Punjab model also gave GHAI the inputs to develop a national trans fat implementation model. And I want to just share that that based on this model, we created sort of a implementation framework that was shared with the CEO FSSAI. And then in September last year, I had the privilege to present this model to all of the state FDA heads at the quarterly FSSAI meeting. So I do want to say that the learnings from Punjab have been taken and shared across the country and are now strengthening trans fat implementation, not just in Punjab, but the rest of India. Next slide. So I would say that, you know, I just want to really emphasize that I know that Punjab has received a lot of accolades, you know, for the Health and Wellness Center acceleration, for the telemedicine, and then there's been an outstanding sort of commitment to media. I want to take this moment to kind of really recognize sort of, you know, the teams. You know, I think the outstanding leadership that Dr. Sonu has brought on this project. He's always been, you know, so hands-on in this effort. You know, I want to recognize Dr. Radhika, who's been sort of a key pillar, you know, in sort of moving the work forward on the health and wellness piece. You know, Dr. Nidhi Jaiswal, who sort of anchored all of these pieces, Dr. Poonam, Kritika, you know, and Mr. Saurabh. I also want to thank the Cypher team, Dr. Rakesh Gupta and Arun Verma. So I just want to say that all along, it's just been an incredible, you know, partnership where everyone has gone above and beyond. And I would fail if I did not thank, you know, and sort of acknowledge the outstanding leadership that, you know, Om Prakash Bera has brought. He's been on the ground in Punjab, you know, really integrated and working with them, and also Lopa, who's led the media. Next slide. So I just want to say that one of, as Sonu, Dr. Sonu just shared, you know, we've had some really creative, both media as well as a lot of interesting events, you know, the yoga day event, you know, the month-long Diwali campaign, and all of this very creative energy, engagement of a lot of political, media, and cultural influencers. So I think the Punjab model, as we now call it at GHAI, has been shared not just within India, but with our hypertension projects around the world. I'm now beginning a mapping and sort of intensive, hypertension project in Bangladesh, and I'm actually carrying the learnings from Punjab to that project. So next slide. So similarly, I want to say these are some images from the trans fat work, and it's been really sort of creative, you know, where it has both had a grass tops approach and a grassroots approach. You know, there's been a lot of, engagement at every level, you know, everything from training of food safety officers, and sort of engagement of the public, engagement of the industry. I think it's just been really both creative from sort of an outreach perspective, from a political mobilization, and obviously from a technical perspective. And I think one of the unexpected outcomes, which we had not planned for, that Dr. Sonu talked about, there's been a lot of research generation, which will contribute both to progress in Punjab and nationally. Next slide. So I just want to, close and thank again, the outstanding leadership from PGIMR and, Cypher, and just, the renewed commitment from Punjab, because I think in doing this, this great work together, they've sort of set a new standard. Once again, sort of acknowledging and thanking Dr. Areet. I also want to thank, and look forward to working with Dr. Sudarshan, from MOH, on all of these critical NCD issues at the national level. And I think we have a lot that we've learned in Punjab that we can take back to Delhi, but also to the rest of the world. So thank you once again. And it's really great to, and I wish I was in Punjab. That was my hope and desire, to be in Punjab at the closure. But unfortunately, COVID did not allow me to be there this week. So hopefully I will get to be there soon. So thank you, everyone.
Thank you so much, Dr. Vandana, for portraying a very comprehensive picture of hypertension control initiatives being undertaken in the state of Punjab. Saurabh, the time has come to introduce our guest of honor of the day.
Please go ahead, Dr. Nidhi.
Now, I would like to invite Dr. Sudarshan Mandal, Deputy Director General, PHIH and NPCDCS, Ministry of Health and Family Welfare, New Delhi. Could we please run these slides?
Yeah, Dr. Nidhi, if you can show that the presentation.
Yes, sir.
First slide.
Dr. Sudarshan Mandal, he did his MBBS from NRS Medical College, Kolkata, and MD in Public Health from All India Institute of Hygiene and Public Health, Kolkata. Dr. Mandal has joined Directorate General of Health Services as Deputy Director General and started work from 16 December 2021. He is a public health specialist with vast teaching experience in All India Institute of Hygiene and Public Health, Kolkata. He worked in the capacity of Additional Deputy Director General TB and Deputy Director General TB since 12th April 2019 to 23rd November 2021. We welcome you, sir, and we would like to deliberate upon Government of India initiatives in advancing hypertension control at the national level. Thank you, sir.
Yeah, can I get the first slide?
Yes, sir.
Yeah. So first, I must extend my gratitude and thanks to Dr. Goel and his team at PGI Chandigarh, and also other fellows like Dr. Vandana and Dr. Sondev, Dr. Rakesh, and many other dignitaries. I mean, they are experts and they are stalwarts in the field of public health, maybe in different components of public health. So my job is here and given by Dr. Goel that I have to mention something about Government of India's initiatives on hypertension at the national level. Before going to the next slide, just I want to mention that I am given 10 minutes time to finish it. So I have to mention, I will mention global and Indian scenario. I mean, burden of disease in the world scenario, at the world scenario, and also at the Indian scenario. So what is the burden? That is, if you want to prevent and control any disease, be it communicable or non-communicable, you have to assess the burden. What is the situational analysis of that particular disease, and in the country and also in the world. And you know that NCDs consist of so many diseases, starting from cancer, then cardiovascular diseases, stroke, diabetes mellitus, and many others. I mean, it includes also CKD, COPD, and other diseases. So it's a spectrum of diseases we are dealing with in one program that is called NPCDCS, National Program for Control of Cancer, Diabetes mellitus, and cardiovascular disease, stroke. And also, I've already mentioned the other two diseases are included in that program, that CKD, COPD, and maybe other also. So of late. So this is the first. I mean, I want to show you the scenario in the world, NCD scenario in the world and in India. And next one is what is the existing initiatives from the Government of India is there. What is there? And the present status also, and finally, is there any way? I mean, we have to show the way forward, how to prevent and control all these NCDs. But today's concern is about hypertension. Hypertension is, you all know, the component of that NCD, and you know, everybody knows about that. What is hypertension, and broadly, we can the management portion of that my hypertension is divided into two. You know that lifestyle modification, which is very important. It includes yoga also, and second one, you know, that pharmacological therapy for hypertension. So next slide, please. Yeah, this slide is very important. You know that I mean, if you talk about the burden global scenario of prevalence of hypertension, you know that I mean, it is the disease, non-communicable disease in the world. I mean, if you consider that total figure, have you? I mean, on the left side of the slide, if you see the prevalence of hypertension in that particular age group of 30 to 79 years, I mean, it's about 650 millions among the male and 626 millions among the females. So altogether, I mean, if you add the two scenario of male and female in the world, figure comes to about 120 crores. I mean, 120 crores means you know that population size of the world is about 7.8 billion. So it's about around about 1.3 billion. So I mean 1.3 billion hypertensive cases in the world out of 7.8 billion. So huge, I mean, prevalence in the world and also in India. I will come to the picture, Indian picture in the next slide. And you know that, I mean, if you consider the mortality also, apart from the morbidity, the mortality is about 15.4% of the total deaths in the world. If you consider the total deaths in the world, 55 million, so 8.5 million constitute the deaths from the hypertension. So huge burden in the world and also in India. And India constitutes about the 19% of the total, I mean, burden of hypertension in the world. You know the population size of India. I mean, it's about 17.8%. So it is a little bit of higher of that population size if you compare the population size of the world and also, I mean, hypertensive burden of the world. It's a little bit higher if you consider the hypertension burden of the world. And if you, it shows you on the right side, you can see the graph line diagram. If you consider the cumulative, I mean, prevalence of hypertension among that, you know, in adults at 18 plus category, age category, these 30 countries are mentioned here in the slide. And these 30 countries constitute about the 80% of the total burden of the world. I mean, these particular 30 countries. And if you mention, I have mentioned there first India. India constitutes total 19% of the total burden of the world, and China also most probably 18.5% of the total burden of the world. If you add together the India and China scenario, it comes to 37.5% of the total burden of hypertension in the world. Can I get this next slide, please? Yeah. So so deaths due to high systolic blood pressure. I mean, we got some reports from the studies, and if you consider the age group 15 to 49 years, I mean, you can see in the Indian map already Punjab is there, and I think Chhattisgarh, West Bengal, and that Maharashtra is there. These are the 4 or 5 I mean states in the country which are having I mean more cases of hypertension and more deaths due to hypertension. And these are the color, you know, in red and in other colors, I mean dark colors. And if you consider the prevalence of hypertension in India, you can see the bar diagram. Almost I mean 25% of the total population, if you consider that age group 18 to 69 years age group, so it's about 25% of the total population, particularly in that age group 18 to 69 years. So if you consider that age group 18 to 69 years, 1 out of 4 persons is hypertensive. So huge burden. It's a huge burden. And if you consider the mortality also, that's a huge burden from the country. And later on, I will go to what program we have started from the government of India side, which has been scaled up to different states. Can I get the next slide, please? Yeah. So now I am coming to the second portion of my presentation. That what are the government initiative we started from the government of India side. As far as that hypertension is concerned, hypertension management is concerned, at the nation level. So you know that in 2016 we have started that national monitoring framework on NCDs. So NCD, you know, NCDs consist of many diseases, including hypertension, and these are the this slide shows about the risk factor of you know, NCDs along with hypertension. So I have tick marked some of the components here. There are 10 targets mentioned in the slide. So first component, you know, that is related actually, tobacco use and use of both smokeless and other tobaccos. 30% relative reduction in the prevalence of tobacco use. That is our target for 2025. And also, if you consider the alcohol also, I know the some state there is more use of harmful alcohols like Punjab and southern states, also West Bengal. And so the target is that 10% relative reduction in harmful use of alcohol. And next target, you know, that 10% relative reduction in the prevalence of insufficient physical activity. And you know, physical inactivity is one of the main risk factor apart from this tobacco use and other risk factors for your, you know, for both diabetes mellitus, hypertension, and other NCD, even for cancer also. So particularly if you come to that component related directly to hypertension, that we proposed we have to reduce that 25% reduction of that prevalence of hypertension in the country. And here I can remember the SDG goal, Sustainable Development Goals, which was settled at in 2015. You know that we have to reduce the main objectives of that goal is that we have to reduce the mortality due to NCDs in our country, in India, by 30% by 2030. And we have thought about that. We have to prepare one national strategic plan, maybe 2023 and 2030, on how to, it will reflect the strategies, how to reduce that 30% mortality due to NCDs. And there are other, target also, and there are other two targets related to hypertension. One is that 30% at the bottom of the slide, you can see that 30% relative reduction in mean population intake of salt and sugar. You know that for hypertensive patients, the sugar intake per day should be reduced below 1.5 gram. Though for normal hypertensive patient, cases, we can give less than 2.5, but for hypertensive patient, it should be reduced to 1.5 gram. And also there is another target you can see at the bottom right side, that 80% availability of affordable basic technologies and essential medicine, very important for hypertension. There are three categories of medicines. First, we can start with that, you know, that calcium channel blocker like amlodipine. So we have to, we have to ensure availability of medicines at the most peripheral level. You know that health and wellness center, maybe a primary health center, and at best that community health center. That's so that patient can get diagnosed and got their medicine throughout the living period, that anti-hypertensive drugs. Apart from that, you know, that lifestyle modification. Can I get the next slide, please? And if you talk about the NCD response by the government of India, we have started that long before, most probably 45 years back in 1975, that India considered at that time the concept of NCD control was mooted at that time, 1975. The first concept of NCD control in the country was mooted in 1975, and we have started some pilot projects in 10 districts of the country. And you know, previously most of the deaths were due to non-communicable disease, not non-communicable disease. But we have started the practicing the dietary habit and other habits of the Western country, and result you can see now. Now in the country, 63% of the deaths are due to NCDs. out of the total deaths. So it's a huge, burden for a country like India, which has a population size of 140 crore at present time. So in 2008, we have started in 10 districts. Thereafter, 2010, that has been scaled up to 100 districts in 21 states. Again, further scaled up to 468 districts. And you know the present figure. I think I can give you the present figure of number of districts where we have started that NCD clinic, and many other, most of the CSC, we have started that, NCD clinic in the CSC. So now the figure is, if you consider the data of 2019-20, 1 year back data, that out of total 48 districts, we have started that NCD clinic in 699 districts. And also, if you consider the CSC level NCD clinic, we have established 4,500 NCD clinics at the CSC level, community health center level, out of 5,300 CSCs in the country. And you know that the districts and CSCs, that number is getting increased day by day. And also, we have to cope up with that number of increased number of districts and CSCs. So that is the scenario, and our target is that in every health and wellness center, we should start the treatment of this hypertension and all other NCD. We have a target of establishing, health and wellness center in the country, 1.5 lakh. But now the present figure tells us that already in 85,000 health and wellness center have been established in the country. Our job is to start that NCD clinic. You can call it clinic or any mini clinic or unit at the NCD at the health and wellness center, so that people, community or the common citizen can get their services, particularly NCD services, at the doorstep of their area. You know that one health and wellness center, if you call it sub-center, that caters 5,000 to 10,000 population. So that is our target, to open and start that NCD services at the health and wellness center. And if you consider that, population-based screening that has been started since I think 2017, and that is going on in full swing. And more cases we are getting from the screening on population-based screening. Of course, the passive screening, you know, that passive screening in the health facilities of the government, that is going on also. Next slide, please. Yeah. These are the objectives. Our program is called National Program for Prevention and Control of Cancer, Diabetes, Cardiovascular Disease. You know that, and stroke. So under cardiovascular disease, hypertension is there. And objective is, these are the objectives, you know, and those people like Dr. Goel and other fellows who are working in this area, they know better than me that health promotion is the first one. Through behavior, and that is the very tough thing for adult population. Behavioral change of adult population in the country. Forbidding so many habits, if you call it bad habits, habits also, the use of tobacco, use of harmful use of alcohol and other, addiction materials. So that is the first one. And second one, that population-based and opportunistic scheme mean that facility-based screening or passive screening at the health care level. And then prevention and control of chronic NCDs, then capacity building of prevention and early diagnosis, treatment of rehabilitation, then support diagnosis. These all these components of or objectives of this national program is known to probably all those who are present in this workshop. And next slide, please. Yeah. this is the figure. Actually, this is the number I have depicted there. How many from the opportunistic screening, the cumulative cases we screened actually 22.2 crore, huge number. I mean, if you consider the population, 30 plus population in the country, that is actually 51 crore at present. So almost we have reached near about half of that portion. We have screened half of the total population of that age group, 30 plus. So next is outreach screening. We have forbidden that, since 2019. That is actually camp approach. But with that, I would say our outreach screening, we screen that much of population. You know, that is a big achievement also, 10 or more than 10 crores. And population based screening we have started of late. 2019. So let's start. We have started late, and already more than 4 crore we have screened. And which is most important, that what I have already mentioned, that we have to start that screening at the Health and Wellness Center, Ayushman Bharat Health and Wellness Center. Everything. Starting from prevention control. Only that prescription will be done by some medical officer. Thereafter, everything should be given by that Health and Wellness Center. So that figure is also a big figure, 11.7 crore screened at the Health and Wellness Center. Yeah. And I have mentioned that already 85,000 Health and Wellness Center have started functioning in the country out of targeted 1.5 lakh. Next slide, please. And this is one of the, this is the ICT application for our NCD screening. Not only NCD screening, diagnosis, treatment, and everything. It's a, it's a total life of a NCD patient. It captured the data of a NCD patients throughout, starting from that, screening, and then diagnosis, then treatment, then follow up, everything. So it has been, done in collaboration with Tata Trust and Dell India. And of course, we have incorporated many experts from the apex level and national level, medical colleges like AIMS and PGI Chandigarh also is there, and also we took help from the NHRC, and it captures the total journey of NCD patients and captured individual beneficiary data and population-based screening. The individual beneficiary data we can get from so many sources, starting from that ASA know that you have heard about that village health guides, and that has been replaced by ASA now. So it caters to a population of 1,000 population at the village level. So ASA through their mobile can capture the data. It's online or offline data up to ANM, and from PSC level it's only online data. So PSC, thereafter ANM tablet is there, and PSC MO level web portal, and also CSC and district level portal, and administrative portal from the district administrator, state administrator, and also administrators who are sitting at the central NCD division, and also health officials like health secretary and other joint secretary, other officials of the ministry, and also official from the Niti Aayog. They can see and also assess the data and assess the situation of the NCD in the country. So there are 3 new additions in the portal, and also we are going to meet that both the Dell India officials and Tata Trust official on a regular basis, how to improve that portal, NCD portal. It is called CPSC NCD portal. And so now of late, that these 3 components are included: that comprehensive clinical decision support system. The Punjab, it is going in Punjab, and under nodal officer Dr. Tendon, Nikhil Tendon, who is doing the job both for the hypertension and diabetes. And there is interoperability with other existing software, and also incentive system for the government of frontline worker. These components are included in that CPSC NCD portal. Can I get the next slide, please? And another is, apart from that, that program and portal of NPCDCS, I mean the NCD. There is another initiative we have started in India, that is called India Hypertension Control Initiative, ISCI, and it is with the collaboration of so many partners, government partner, ICMR, and global level NGOs like WHO India, state government, and last not the least, actually, the Resolve to Save Lives. I mean, the Resolve to Save Lives, it's an international organization whose target is to, reduce the deaths from hypertension by 10 crore. They want to reduce the 10 crore deaths from hypertension by 2025. So they are also they are our partner also, and it's a very simple app, and name of the where the data is being captured also called Simple. It has 5 components. You can see, just I'm going through it: the treatment protocol, medication supply, task sharing, and team-based care, information system. Information system, we have to collect data and convert into information by collation and analyzing of those data, and also patient level, patient-centered care. So all those components. But recently we have taken decision that we have to merge this portal of ISCI with our CPSC NCD portal, so that the people who are working at the peripheral level, the ASAs and the ANM, MO, PSC, it would be a very simpler one if they get only one portal instead of having 2 portal like this Simple portal along with that CPSC NCD portal. So that decision has been taken, and we have asked the Tata Trust and Dell India that you have to merge this portal along with our CPSC NCD portal. So that work is going on. Next slide, please. Yeah, this is the scale-up scenario of that ICI initiative in the country. The first phase, the green one, though we have taken the most hypertensive burden of states like Punjab. So Chhattisgarh, I think, is there, and Maharashtra and Madhya Pradesh we have taken also in the first phase, and then in the second phase, you can see the other state also. And the initiative I have already mentioned that our job through this initiative is to prevent, not only prevent and control. Control means to reduce the morbidity of hypertension, to reduce the deaths from hypertension through this initiative. Next slide, please. Yeah. So that has been scaled up to 19 states now, out of 36 states and union territories in the country. So it is going in full-fledged now, and very soon we will capture the other states also, rest of the 17 states and union territories. And it has been scaled up to 101 districts, though number of districts 748. Quickly we could capture the other districts also. And the figure, that data, we have captured 2 million data hypertensive patients. And also, initially it was started for hypertensive patients only, and later on we have included diabetes mellitus also. That's why the figure of diabetes is a little bit of less than the figure of, that hypertensive cases. And so many health center facilities, at more than 13,000 health facilities, were included for under this initiative, ICA. Next slide, please. Yeah, this is all about the Simple. So I may skip this slide. Go to the next slide. This is all about, that non-pharmacological intervention, starting from, yoga is of course there. Yoga, physical exercise, everything, but weight loss, for obese patient and the patients, the persons who are having BMI more than 23.6, or better to say 25 BMI, more than 25 BMI, they have to reduce weight to the normal level, and healthy diets according to that DASH diet, you know, that I mean, green fruit and vegetables. Everybody knows that we have to add, and person should take at least 400 grams of fruits and vegetables daily. I mean, most of the Indians are not taking actually. And then whole grains you have to take, and low fat dietary fats to restrict the saturated fat, and also reduce content of that saturated and trans fatty acids. Already that has been mentioned by two speakers before me. And I have mentioned, and okay, I have mentioned that also, that amount of salt to be taken less than 1.5 gram. And the result and outcome of this taking less amount of salt is there on the right side. And enhance intake of dietary potassium to reduce hypertension. Also, it will, I mean, for the cardiac patient also, I mean, coronary heart disease patient also, it helps. And altogether, physical brisk walking, I know that, you know, that we have to do brisk walking at least 30 minutes per day, at least 5 days in a week, so 150 minutes average. But that range is given there. But my advice that we have to go for at least 150 minutes brisk walking per day, per week. Per day it's 30 minutes for 5 days in a week. So result is given in the right side, and also moderation in alcohol intake for men, less than 2 drinks, and there is a definition of drinks. And women also less than 1 drink per day. Next slide, please. So thank you very much, Dr. Goel and other fellows of PGI Chandigarh, and also so many dignitaries from the partner organization. Thank you very much. Thank you for giving me scope to speak something about national initiatives of hypertension. Thank you very much.
Thank you, Dr. Sudarshan. I think you have given a very good overview about I think a lot of things about the program. And the good thing which I can see from you is you are a very appropriate mix of academia and a implementer. And that is what actually we are, because we have that academic feeling, and we always try to learn from academia and do in the implementation sector. I would love to meet you in Delhi, and I think a lot to discuss on how to advance hypertension at the national level.
So I am told that my job is program manager. I have to manage the things. I am not an expert.
But sir, yes,
okay,
I think you had that academic touch, and I think when we move technically in an evidence-based manner, and I think we would be able to do better.
So we have to take so many good practices. I can call it best practices from Punjab state through PGI Chandigarh. I mean, you are doing the great job, you and other fellows also. So I have heard so many things. I mean, so many new things also. So our target is to scale up all those good or best initiatives throughout the country.
Maybe we will definitely
let other state also imbibe these best practices for their benefit and save many lives from hypertension. Thank you very much.
We'll definitely like to work more closely with the government. I think we have been working with Dr. Swasti Charan in tobacco control, and we would love to work with you as well for advancing this hypertension and all these initiatives at the national level.
Thank you.
Right. So over to Nidhi. Yeah. Vandana ji, do you want to speak something?
I was just going to also share that I think the project from PGIMR Chandigarh has been so, such a great learning, Dr. Sudarshan, that, we've also gotten some interest from other states, from UP, Haryana, a few other states. So we will continue working closely with Dr. Sonu and his team, and we've expanded the partnership to bring on AIIMS Jodhpur on board as a technical assistance partner to other states, especially in northern India. We've had several states show interest in all of the hypertension learnings. And I think Punjab will definitely remain our focus based on the, on the efforts there. So, we would love to, work with you, Dr. Sudarshan, and we'll follow up so that we can share all of the learnings that we're getting.
Yeah. Thank you, Dr. Vandana. I'm looking forward to work with
you and all
other fellows who are present here. Thank you very much.
Okay. Thank you.
Thank you, Vandana. Thank you. And looking forward to continued collaboration with you. Over to Nidhi.
Now I take this opportunity to welcome Dr. Rakesh Gupta, President and Director Public Health, Cypher, to introduce our chief guest. Dr. Rakesh Gupta is the President and Director of Public Health Strategic Institute for Public Health Education Research. He is a former Director Health Services and Director of Chemical Examiner Lab Punjab. He is alumni of Johns Hopkins School of Public Health, Baltimore 2012 and University of California, San Francisco 2012. He has received recognition for WHO Award 2015 on World No Tobacco Day and represented Ministry of Health and Family Welfare for a consultation in Panama 2016 and Geneva 2017. I welcome you, sir.
Thank you, Dr. Nidhi. And I think our chief guest, Mr. Channi, so he won't be able to make it because of his commitment, those political commitments since this ongoing process of elections. And can you show the slide? So he was supposed to join at 6, but he just informed me that Mr. Rajkamal Chaudhary, he's our Principal Secretary, Health and Family Welfare. He just informed me that he is stuck in a meeting in main secretariat, but he can join anytime. So he's a very senior IAS officer of 96 batch and presently working as Principal Secretary. And he earlier in maybe 14, 15, we worked with him. He was then MD NHM and he worked very in a very passionate manner and we learned a lot from him. So hopefully he'll be able to join very soon, right? So, and Mr. Channi, I have worked in because I have stayed in Chamkaur Sahib for almost 16 years and Chamkaur Sahib is his constituency. So since first time he was elected as a MLA, as an independent MLA, and we have been working very closely with him. And he is in fact a very, presently he's doing PhD in a subject. I'm not aware of the subject, but he has been very supportive in this initiative. So I don't think he'll be able to join, but we really thank for his message. His message says that I congratulate the Department of Community Medicine and School of Public Health for organizing the National Dissemination Workshop. And I give my best wishes to the PGI team for its greater achievements in the coming year for reducing the burden of hypertension and cardiovascular diseases and strengthening the transfer and regulation in the state of Punjab and ensure all possible support to PGI in implementing the hypertension related activities at the state and district level. So thank you, sir, for this lovely message. So over to Dr. Nidhi, please. Yeah. So I think we can now, all the dignitaries available, they can release the this document.
Yeah.
So Dr. Nidhi.
Maybe briefly, we can all switch on our videos for release of these 3-4 things which we have planned towards the end of the workshop. So can we switch on our videos so that we can take photograph as well and we can have a joint release?
Yes, sir. It is well said that power is gained by sharing knowledge, not hoarding it. Yes, friends, I'm talking about the key harvests of the project, which are going to be released soon.
We will be making 4 releases today. First, 8th edition of our newsletter, Cardio Health, Digitalization of Health and Wellness Center. Dr. Radhika Rana, Technical Officer, Health and Wellness Center, would brief you about the newsletter.
Thank you, Mr. Saurabh. The Resource Center for Cardiovascular Health, PGIMR Chandigarh, is happy to release the newsletter focusing digitalization of health and wellness centers in the Punjab and its pivotal role in strengthening comprehensive primary healthcare services across the state. This newsletter refers to the digital initiative in the form of telemedicine, electronic health records, real-time reporting, and capacity building trainings in the Punjab and other states in the country under D-Health program. This newsletter also highlights that it has finally gained momentum in health sector, providing essential healthcare services, diagnostics and drugs at the doorstep of the community. Thank you.
I request everyone to say release.
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 Can we see the newsletter? Yes. Right. So it's a 12-page newsletter which summarizes the achievements of Punjab in digitalization of health and wellness center. So I think this is one of the best practice, and we will be sharing with Dr. Sudarshan this newsletter, because this summarizes all the activities which Punjab has did in digitalization of health and wellness center.
Okay, Dr. Goel, send one copy.
Yes, sure. I'll be sending the copy to you, sir. Yes, next, please.
Our second release is media report. Dr. Kritika Upadhyay, Technical Officer, Monitoring and Evaluation, would give a brief description of the media report.
Thank you very much. Media plays a very crucial role in expanding the audience reach, disseminating the health information, and increasing the awareness about the health education for changing the attitude and behavior among the audience. So one of the significant components of the project was to generate the media support for strengthening the hypertension services in Punjab through generation of media stories on patient diagnosis, treatment compliance, control, looking after the trans fat, elimination, and strengthening of health and wellness centers. In this last 1 year, we have done around 15 major media activities, which include workshops, campaign, panel discussion, press meets, and interviews were conducted with various stakeholders. Let me tell you, a total of 285 news articles were published in 90 leading print and online newspaper, focusing on the pragmatic issues related to hypertension, trans fat, and health and wellness center. The readership of these 285 news items varied from 3,000 to 180,000 population. And the hypothetical value of the earned media was almost double when we compared with the total expenditure of the project funded by Global Health Advocacy Incubator. So I would like to tell you the outcome of the component has been proved to be a very cost effective in terms of reaching a larger audience, covering the remotest areas and the underprivileged communities, and thereby cutting the significant amount of cost during the implementation of the project. With this, I request all the dignitaries present here to please officially release the media report.
I request everyone to say
Release.
Release.
And want to thank, special thanks to Lopa Ghosh. I think she was instrumental in training our people and regularly conducting meeting every week for enhancing this media coverage. So thank you, Lopa. Thank you very much.
Thank you. It has been a pleasure, absolute pleasure.
Right. Thank you. Can we move to the next release? Saurav, Nidhi?
The third is annual report. For this, I invite Dr. Nidhi Jaswal, Technical Officer, Hypertension Program.
Thank you, Saurabh. So the annual report of the project, it portrays the comprehensive picture of the annual activities carried out in the phase 2 of the project. And I feel honored to announce that we have received a formal forward from our Honorable Chief Minister, Punjab. The report has prefaced from our Principal Investigator, Professor Sonu Goel, executive summary, testimonials from the experts, and component-wise description of the activities. So I hereby request everyone to officially release our annual report.
I request everyone to say release.
Release.
So this is the foreword which has been given by Honorable Chief Minister of the state. Consecutively for the second time, we have received, last time we have received received the forward from the health minister of the state last year. And this time, this annual report received forward from our chief minister, current chief minister of the state. Next.
Dr. Mahendra, could you please move the slides? Yes, thank you.
So this is basically just a glimpse of the report. You can see like various alumnus testimonials from various people from at the national, international, at the local level. We have the aims and objective of the project, and we have divided the report, a big report basically, into smaller parts like hypertension program. And then this is basically about what are the various activities which we did, release of the edition of cardio health, right from the first edition to the last edition. These are all the activities, the glimpses of all the activities which we did, and a short summary of each activity. This is the research component, how we advanced research in the area of this project. And these are the key recommendations of the project. These are all media coverages, the glimpse photograph of different activities. Yes.
And the fourth is documentary of the project. Dr. Mahendra Pratap Singh, the technical officer of TransFed program, would brief about this documentary.
Since invention of the photography around 1830 and videography around 90s, various people used such a medium to promote commercials and other activities. However, various scientists and clinicians used this method to communicate, awareness method and other method to communicate with the general audience. We also followed the same path. We prepared 3 documentaries about trans-fat and front of package labeling. One documentary about trans-fat was awarded by the director of PGMIR Chandigarh, and another documentary on front of package labeling has been submitted to the film festival of India, which is being organized by the Ministry of Information and Broadcasting, Government of India. These documentary has been uploaded in the various platforms, including YouTube and Facebook, which has been received wider views from a diverse audience of the country as well as some abroad audience. So we can have a glimpse of the documentary which we prepared about the project, current project. So we can say a release of this official documentary about the project. Yeah.
Release.
In the meantime, documentary is played. So just to inform you that Director PGI has awarded on the Hindi on the National Hindi Day, we have been awarded the first prize for the documentary on trans-fat free Diwali last year. So this was one of the achievement of the project again.
Cardiovascular diseases are the major causes of morbidity and mortality around the world. In India itself, around 45% of deaths between 40 to 69 years of age are attributable to cardiovascular diseases, and this is a major cause of concern. Global Health Advocacy Incubator funded project is being implemented by the Department of Community Medicine and School of Public Health, PGI-MER, since 2019. and they have been disseminating information about this in the forms of webinars, seminar, workshops, panel discussions about CVDs and the causal factors like hypertension. I, Dr. Sanjeev Singh Sodhi, President Indian Medical Association Mohali, Punjab, fully endorse their activities and appreciate it, and also assure them of my timeless support in all their endeavors and projects in the future to prevent the incidence of coronary artery disease and CVDs and its causal factors like hypertension.
I would like to congratulate the Department of Community Medicine School of Public Health, PGIMR, Chandigarh, on the successful completion of the hypertension project. Hypertension is a growing problem in India, and so are the risk factors, which are increasingly leading to a crisis situation and a significant burden on health systems. In the past 2 years, various advocacy and capacity building activities have been taken by PGIMR under this project. They have also instituted research, capacity building at the field level, capacity building of researchers, as well as academic engagement across the board. All of these activities have made a substantial contribution in building health systems as well as strengthening the capacity of academics and field level workers. We really appreciate the partnership with PGIMR and hope to continue to work closely with them.
मैं मिल्खा सिंह की तरफ से सबको
As per the 5th round of National Family Health Survey report recently released, hypertension is a very big problem in the state of Punjab. We have almost 1/3 of adults suffering from hypertension. Considering this, PGI, in collaboration with Cypher and Global Health Advocacy Incubator, launched a project in 2019 to reduce the prevalence of hypertension. In this, we have done several activities which included a MOU with Government of Punjab for strengthening the trans fat surveillance, celebrating a 1-month-long trans fat-free Diwali campaign, Yoga High and BP Bye campaign which was endorsed by PGI, and recently a research initiative in which we collaborated with 50+ institutes across country to write research papers on this hypertension problem. We wish to collaborate with various organizations in government and non-government sector to reduce this burden of hypertension so as to minimize the non-communicable disease burden in the state of Punjab.
Thank you all for releasing officially our key harvest of our project. Now we are moving towards our plenary session, advancing hypertension control through political advocacy, transfed regulation, media engagement, and harnessing telemedicine through health and wellness centers in the state of Punjab. And I would like to invite our first speaker of the day, Dr. Sandeep Gill. Dr. Sandeep Gill is the Assistant Director and State Nodal Officer, NPCDCS Punjab. He has done his MBBS from GMC Patiala, MD from GMC Patiala. He has a 5 years experience in primary and secondary public health facilities. And he is a fellow at ICMR NIE Chennai, India. We welcome you, sir. And I request you to kindly describe the state's initiatives in the prevention and control of hypertension.
Yeah, thank you, Nidhi. Good evening once again to everyone. And I start with, thanks to Dr. for joining us from Delhi and Dr. Ari, our Director NHM, to be with us. And I thank you, the team at PGI, Professor Sonu Goel, and Dr. Rakesh Gupta, who had been our director earlier with the DHS, and now he's President Cypher, and Madam Vandana Shah from US Global Health Advocacy Incubator. So thank you for inviting me to talk on state initiatives on hyper control, prevention and control. So first of all, I think in the slide, it's shown 5 years of experience in primary and secondary. Well, it is 25 years of experience in primary and secondary healthcare. And of course, I worked for tertiary care also. And please allow me to share a few slides. By the time I'll just start with the state of affair of NCDs, how they started, in the state of Punjab, way background aspect of the non-communicable diseases.
Sir, sorry to interrupt you. You can share your slides.
Yeah, thank you. So before I start with my learning about the initiatives we have in state of Punjab. Punjab has been agrarian state, from the very beginning, and in around 1960s, the state had green revolution, and that green revolution brought the prosperity, and the prosperity brought a lot of obesity and lifestyle changes. So now by 70s, there was a transition of this burden was happening in the state from communicable to the non-communicable. And by early 20s, there was a big burden of about 60 to 70% of the disease burden as non-communicable diseases. So because we had a very rich culture, and we have a lot of NRI population also who Western culture back to Punjab, and this Western culture brought lifestyle modifications and things related with that. Of course, the consumption of high fat, consumption of alcohol, and consumption of tobacco has been adding factor, which were already there in the state in high in proportions. So how we are tackling the problem in Punjab is, as Dr. Sudarshan has been shared with us earlier, the NPCDC program. This is a national program for prevention and control of cancer, diabetes, cardiovascular disease, and stroke. With this, cardiovascular diseases are being tackled along with other NCDs, and hypertension is the primary root cause of all the cardiovascular disorders. Maybe it's a stroke, or maybe it's a myocardial infarction, or if it is central retinal artery occlusion or leading to blindness. So many things, atherosclerosis leading to other disorders of veins and arteries.
Sir, sorry to interrupt you. Sir, your slides are not visible.
Are not visible?
Your slides, sir. You are visible, sir.
All right. I'll have to do it again, probably. Let me retry. Huh?
No, sir. Still not.
Well, this is
Sandeep, I think you can carry on like that without.
Okay, this is the disadvantage of the technology.
Okay. It is okay. It's okay.
Fine. Well, concern is like, I just wanted to share what we are doing in the state of Punjab, so under the program NPCDCS, which is running in whole of the state, it started in way back in 2010, and 2016 and 17, we had covered all the districts with the program. And then in this program, we do first component is of our screening, as any disease, screening is the primary thing to know and make a policy or do management. And in way back, it started with the sub-center level door-to-door screening. And A&M used to visit houses and check for diabetes and hypertension and 3 cancers, oral, breast, and cervical cancer. And eventually, I'll just not go into that too much of background, but then I'd like to share that in last year, that is 21 financial year, we had screened 7,24,000 individuals, and out of which 1,22,108 individuals were suspected of having hypertension. So this again in 2021 and 22, we had almost similar figures, about 6 lakhs screened up, and about 1 lakh suspected hypertensives by this screening method of door-to-door screening. Other screening we are doing is that opportunistic screening. That's where our healthcare facilities, they are catching the patient for any other ailment, and then they are checked for their blood pressure, and if rechecked, if having high blood pressure, and then diagnosed by a medical officer in that opportunistic screening, and then put on treatment. So in last year, 2021, we had 10 lakh individuals who attended our NCD clinics, and they were screened, and of which we had approximately 1,60,000 who were diagnosed in that opportunistic screening. So these are some of the figures, and this is a continuous process. We keep doing all the opportunistic screening and door-to-door screening. With opportunistic screening, under the program, we have a prevalence of about 15.6% hypertension, and we have 12% of prevalence of diabetes. Well, the latest National Family Survey shows that Punjab is having 7.6% of prevalence of hypertension, which I believe is almost more appropriate because many survey and data they have a different variable, like under IHCI also we have almost similar 25 to 30% prevalence of hypertension. So for cardiovascular health, since hypertension main concern, but then hypertension leads to stroke and ailments. So we have taken, we have started stroke ready units. We have in 9 districts, we have running this stroke ready units and coronary care units, in 14 of the districts. Recently, we had started, a good initiative of introducing arm-in blood pressure apparatus at all our district hospitals, where every individual who is above 30 years of age will be, checked mandatory. Will pass through that that NCD clinic room, and his blood pressure will be checked. So that reduces the burden on the medical officer or the medical specialist sitting in that room. Reduces the burden also. Another initiative we have taken is the STEMI project, ST Elevation MI, and we started this in 2 districts. And initially we started in Patiala and Ludhiana. Subsequently, we have 5 more districts, recently Shiarpur, Fatehgarh Sahib, Ropur, Nawashahar, and Mohali. So Ludhiana model, Ludhiana district is being, led by Dr. Bishamohan, who is HOD cardiology at DMC, and Patiala district and allied districts, which are recently added, are under Professor and Head Cardiology, Dr. Srinivas Reddy, GMCH Secretary. We proudly share this information that IHCI started in the first phase, and the Punjab was the first state to start with. Then the rest of the states did in first phase. Later on, Telangana, Madhya Pradesh, Maharashtra, and Kerala, they subsequently they were added on, and we had started this in 2018, and somehow there were delays and up till 2019. Now, recently, because this project started in 5 districts, and recently we have another 5 districts also. Now, this project, India Hypertension Control Initiative, is running in 10 districts out of 3 now, currently 23 districts for hypertension control and management. The good part of this IHC program is that this has brought us a treatment compliance in our patients. That with follow-up is there. There is a mechanism, like Dr. Darshan was explaining. There is a BP passport. There is a simple app, which is requested, their team, their IT team, to integrate into our CPHC NCD portal. So one of the initiatives which we had done, and we have expanded it to total 10 districts. Main strategy under IHCI is that this is a decentralized form, like where the human resource which has been given to us through this project by WHO, ICMR, they cardiovascular health officers, and they monitor these districts with the help of some paramedic staff, the supervisors, and they support our ASHA, our A&M, and our CHOs, to implement, this project, where this is focused project for hypertension control. And almost we have compliance, treatment compliance of about 45 to 50%, which is very good. Like usually, as under the NPCDCS program, we don't have any follow-up mechanism, and then we're looking forward from the ministry that we need a revision of some of the guidelines and new methodologies. Especially there is a replication of data, because many projects are running in the state, like one is IHCI, and then another is another project iTrack with Dr. mentioning about Dr. Nikhil Tandon from AIMS. He has this project running in one of our districts, Nawashahar, and in the one block only. We are likely to expand that also. But then there is a need for integrating this data, because otherwise this gets replicated and duplicated. Data is not of any value if we cannot use that data. I'm glad that Prime Minister has taken an initiative for National Digital Health Mission, and the NPCDC is a nodal program which is interested with an ask of enrolling this digital ID for the citizens of state of Punjab, and of course in other states also. NPCDCS will be partner in digitalizing health IDs. So these are some of the initiatives we are doing in the state, and of course we are doing a lot of IEC activity, BCC activity. We have designed a special IEC activity. We designed a chitti. We call it chitti. This is a letter directly to the beneficiary of hypertension with do's and don'ts. To eat less salt, to eat less fatty food, to do daily walk, and to take his medication. That they are all good do's and don'ts, written in a letter. And this was released by our then Health Minister Shri Balbir Singh Sidhuji under his signature. This was being distributed, to the beneficiary through ANM and through the ASHA, directly hitting them, because many, I think many of you will agree with me that this mass media sometimes needs correction. If it is not news, if we are news of any good health, or thing which is in the newspaper, but the access is to it, at the grassroots level. So with this, I'll not take much more time. So these are some of the initiatives which we have taken, and I thank you once again for giving me opportunity to share my thoughts on hypertension control and prevention.
Thank you, sir, for highlighting the key initiatives being undertaken by the state government in the prevention and control of hypertension.
Yeah, thank you so much.
I take this opportunity to invite the next speaker of the day, Dr. Areet Kaur, Director, National Health Mission Punjab. I would like to emphasize that she has been an instrumental in achieving our objective related to the operationalization and strengthening of health and wellness center in the state. Dr. Areet worked as an eye surgeon with the government of Punjab for over 3 decades. Punjab became the top state in operationalizing the maximum number of health and wellness center and continued to be one of the best state in the country for health and wellness center performance. She was also state nodal officer of the National Program for Control of Blindness and Visual Impairment. State Program Officer, National Tobacco Control Program. She was an instrumental in passing the legislation to ban hookah bars in the state in 2018. Under her supervision, DH Mohali was one of the best managed COVID hospital and first one to manage delivery of COVID positive pregnant women in the state. Today, she will be speaking on the hypertension control using telemedicine services through Health and Wellness Center in the state of Punjab.
We welcome you, ma'am.
Thank you. Thank you. Greetings to PGI team, greetings to the GHAI team, and greetings to the Cypher team and other dignitaries. I will be very quick because I believe we are running late. But as far as health and wellness centers are concerned, we were I am supposed to speak on the telemedicine part of it, but at the outset, I would like to emphasize that we are still passing through the COVID pandemic in the state as well as around the world. So the telemedicine services and all other work which was supposed to be done by health wellness centers is not as it would have been if there was no COVID. But because of the presence of health wellness centers and the health wellness center team, so at present we have 2,350 community health officers and 2,350 operational health wellness centers across the state. Each health and wellness center has a team of a community health officer, 2 multi-purpose health workers, and 5 ASHAs. Am I audible?
You're audible, Dr. V. You're audible.
Okay, next slide, please. So this is the team. Next slide, please. So as per the Health Wellness Center program, there were 12 services which every health and wellness center was supposed to be delivering, and in which point number 7 was about screening, prevention, control and management of non-communicable diseases, which included hypertension, diabetes and other NCDs. Next, please. Here, I would also say that the program was launched in Punjab in January 2019. And in the beginning, we just had in 2019 about 300 operational HWCs across the state. And by the time the COVID struck the country in March 2020, we had around 1,000 health wellness centers. And it was at that point of time when the telemedicine services came into play, because we discovered that now the health wellness centers cannot be operational because there was a lockdown in the country, very severe lockdown, and people, especially in rural areas, were not able to access medical help because there was no public transport available also. So at that time, our health wellness centers remained operational on all days, including Sundays and guested holidays, from morning till evening. And it was at that time in March 20, when with the help of Cypher and GHAI team, we were delivered 300 dongles with lot of difficulty, and we started teleconsultation services. Next, please. So when we talk of service delivery at health wellness centers, and when I'm talking about OPD services and hypertension screening, which is the, as you can see, the figure is in lakhs, the hypertension screening, diabetes screening is all which was being done by the health wellness center teams before COVID. There has been very little progress in last 2 years because of COVID. Next slide, please. Because most of our work these days, from March 20 onwards, the community health officer and the HWC team is involved with COVID work. It is the health wellness center teams in rural areas. And I must tell you that we have a 3 crore population in Punjab, and almost 2 crore is in villages, because head count was also done during, there was a mission, door-to-door mission into 2021, which was also done by the health wellness centers team. When we calculated the rural population for COVID, that was almost touching 2 crore. So our teams in rural areas are, all our health wellness centers are in rural areas, and our health wellness center teams are doing COVID work, be it vaccination, be it sampling, be it home monitoring of isolation, patients in isolation. Next slide, please. Next, please. So this is, when I'm talking about telemedicine, I want to emphasize that telemedicine services, which were supposed to be, very robust, they are very robust. But at present, our CHOs and our HWC teams are involved with the vaccination and sampling, and because they had internets, because they had computers, because they had printers, so this is coming very handy to people of the state, because as you all know that sampling and vaccination has to be made online at the same time. So because our HWC teams already had the internet access and the systems, so they are able to manage the COVID work very well. And I cannot help but think, if there were no health wellness centers, who would have looked after our rural population? How our people in villages would have to travel to cities or PHCs? There are very few PHCs for vaccination, for sampling, or for medicines. So I feel very proud that in shortest span of time, we have been able to operationalize all our health wellness centers, all our sub centers, which were supposed to be operationalized, because whatever we are left with at present is these are those centers which are co-located with primary health centers. I mean to say that those sub centers which were located inside primary health centers are only ones now left without a community health officer. Rest all are operationalized. So here, when we talk of telemedicine, so we started, as I said earlier, in March 20 with the help of Cypher. We were given 300 dongles, and now at present we have 1,570 centers which have the system and which have internet. We are still not been able to operationalize all our centers, because they said there is some chip problem, so the computers are not available in the country at present. So so we have 1,570 health wellness centers connected through telemedicine. They are the spokes, and we have now 2 hubs at Amritsar and Chandigarh, and we work through hub and spoke model. And CDAX eSanjeevani telemedicine app is being used for teleconsultation. Next, please. So as I said, we have 20 medical officers, 1 gynecologist, and 1 telemedicine executive at the 2 hubs we have in Chandigarh and Amritsar. And we have these 1,500 plus spokes. And till date, 1,40,534 teleconsultations have been made. So these days, because all our teams are doing COVID work, and most of the time they are doing outreach camps for vaccination and sampling, that's why they are not able to do consultation, which would have been much more if there was no COVID. Next, please. So the flow of care for hypertensive patients is this, that as told earlier to all, that CE-back performa was being filled by ASHAs and checked by ANMs. And then we was also having, before COVID in 2020, that all those people who were suspected to have NCDs, we used to have a camp-like thing on one particular day in a village, where ASHA will give message and all suspected patients will come, and a medical officer from PHC would also come, so that at the same time BP would be checked, sugar would be checked, and in case there was a need for medicine, that would be prescribed by the medical officer. In case there was the patient was having normal blood pressure or sugar, then the lifestyle IEC activity around the disease would be undertaken, which in any case would be undertaken. I will come to that later. Next, please. So this is how a prescription is generated at the teleconsultation hub. I feel proud of the fact that we are, I must here at this point of time thank Dr. from GHAI. Whenever he visits the state, he always comes with very good suggestions, and I always look up to him for giving me more suggestions, because we were very skeptical. You see, when a teleconsultation is being done, the patient is on the other end, the doctor is at the other end, and the CHO is the mediator. So how to go about the consultation? So as you can see that the teleconsultation, the quality of the teleconsultation, Dr. Om told me that we must have teleconsultation audit. So we regularly are doing the audit for our prescriptions also, that our medical officer is giving good prescription, and the community health officer is also doing the teleconsultation seriously. It is not that just, you see, just to increase number or to show figures we are doing it. So we regularly do audit of our consultations, of our prescriptions. And as you can see that whenever the medicine is prescribed, also suggestions about diet and exercise and weight control are also given by the doctor at the hub. Next, please. So all the community health officers have been very thoroughly briefed about you see, not the medicine is not all, because hypertension, diabetes, etc., lifestyle diseases. So we have to tell the CHO, which they are doing, that patients should be briefed on diet, on the role of exercise, and other related things. Next, please. So very simply, they are told that ideal body weight should be weight in centimeters minus 100. So if the weight is more, because as told by Dr. Sandeep, obesity is rampant in Punjab. So about the body weight, about healthy eating, about regular meals, about limit in the intake of salt and fried foods, and about trans fats. I mean, as far as trans fats go, we have talked about them a lot, and all the celebrations in rural areas of Punjab were undertaken. Celebration by celebration, I mean the IEC activity was undertaken by CHOs, and even during COVID pandemic last year, during Lodi and Diwali time, awareness around trans fats, IC activity was organized by our CHOs. Also, alcohol, as you know, is very big factor in Punjab. About alcohol and about tobacco also, CHOs do IC activity. Next, please. And as per the mandate of the wellness activity, which every health and wellness center is supposed to undertake, so yoga, cycling, or walking activity, all these things are undertaken at health wellness center level, and regular yoga camps, even Gidda camps and dance camps are organized by the CHO team at health wellness center. Next, please. Also here, I heard Dr. Vandana saying that GHAI is doing maternal health work here. Here I don't want to miss the opportunity to request GHAI to help the state with our very high maternal mortality rate, which is really something which we feel very much concerned. So though health and wellness centers were not primarily MCH service provider stations, but our focus has been on because of the high MMR during COVID. We had during second wave of COVID, we had a special helpline telephone number operating from our hubs, where a pregnant woman can call the doctor, because a lot of our pregnant women got COVID positive during the second wave with high mortality also. So all our CHOs were reporting pregnant COVID patients at the tele consultation hub, also reporting if a close family member of a pregnant woman was getting positive. And I feel proud to say that we were able to organize timely referral, first timely enumeration of COVID positive pregnancy. Every day we were making a fresh list of COVID positive mothers, and our doctors at the hub would call that COVID positive pregnant mother, and the CHO were aware of it, and we were able to timely refer many positive girls when the CHO found that the oxygen levels were dipping or there was some other complication. So that's why there is a gynecologist also posted in our hub, and all high-risk pregnancy cases are supposed to be consulted by her. Teleconsultation CHOs do for high-risk pregnant women. So this was 8% of maternal deaths are also due to pregnancy-induced hypertension. So we are doing line listing, as I have told you earlier. Next, please. Next slide, please. So as I said that 2.17 lakh wellness sessions so far have been conducted in the state in the last 3 years. We have just completed 3 years, but 3 years is not for all, because we started with only 300 centers. And all health wellness centers are provided with the Eat Right toolkit, where the CHO is guided about the right things as far as the eating habits are concerned, which this is the education which she can impart to her patients. So next, please. Slide, please. Every health wellness center has 61 free medicines available. Every health and wellness center has 6 diagnostic tests available, and a toolkit with the BP apparatus, with a glucometer, with the weighing machine, etc., and a suturing kit, and things like that has been provided to every health wellness center. Next, please. So we developed a drug delivery system also, though we could only run a model. It was not approved by our seniors. From that from the warehouse we were supplying medicines directly to health wellness centers every quarter. Next slide, please. So in the next year, in this year, I want to say that we want to operationalize all our remaining health sub-centers at health wellness centers. We hope that we will be able to connect all our health wellness centers with the hub in Chandigarh and Amritsar. And we also want to have a specialist cell in our hub for teleconsultation. That's all. Thank you so much.
Thank you, ma'am, for a very comprehensive presentation regarding the roles of Health and Wellness Center in advancing screening of hypertension and diabetes using telemedicine services. Thank you, ma'am. Thank you so much.
Thank you.
Sorry to interrupt you, ma'am. Before moving ahead, I would like to take a group photograph. So everyone, please switch on your video camera, and we would like to take some photographs. So everyone, please switch on your video camera. Okay, thank you. Thank you.
My video camera takes time. Yeah.
Okay. Yes, sir. I have taken a few more pictures. Thank you, sir. Thank you, everyone.
Allow me to introduce our next speaker of the day, Ms. Lopa Ghosh. She will deliberate upon the media engagement in prevention and control of cardiovascular diseases in the state of Punjab. Ms. Lopa is a country media coordinator for GHAI. She has a master's degrees in communication from the London School of Economics, a development and communications practitioner for over 2 decades. Ms. Lopa was a core member of the UN Drafting Committee for India's recommendations on Sustainable Development Goals and has led the India chapter of MY World 2015, a global citizens movement. She has worked on several high-impact UN campaigns, including the Guinness World Record holding Global Anti-Poverty Campaign Stand Up and Take Action. We welcome you, ma'am. Over to you.
Thank you, Dr. Nidhi. Will you be sharing my slides or would you like me to?
Yes, we will be sharing.
So I'm not going to take much time because I know we are already late in the evening and it's been a wonderful discussion so far. A lot of fantastic discussion has already taken place. So I really don't have much to add because we've also talked about the media piece. But just wanted to, of course, once again say that it's such a privilege to be part of this fantastic celebration of some wonderful work that has taken place in the last 2 years. And my heartfelt thanks to Team PGI-MER for inviting me to talk about a pillar of the project that we've all been very passionate about. And it's really wonderful for all of us who have worked behind the scenes that the media engagement piece has been such a strong outcome of this project. And as media advocates, I think we know that it's not easy. Next slide, please. Yeah. So in the interest of time, I won't really be sharing numbers or specific highlights with you, but I'll just sort of take this opportunity instead to recognize and celebrate the tools and strategies that have made the media engagement piece such a big success, and really hope that we can replicate the model wherever we get an opportunity next. So to really start with these two questions, how is it that hypertension became and remained top news in Punjab? Similarly, how is it that a relatively lesser known issue like TFA elimination became so media worthy that we were able to maintain a colorful campaign for 2 years, and with, of course, a lot of colorful moments, and there was so much of interest from the media to talk about an issue that actually, when we started out in 2019, the TFA elimination piece particularly, there was hardly any awareness, and it was seen as a very nuanced issue, a very technical issue, and not just TFA, even hypertension, which of course we talk of hypertension as a silent epidemic, and we know that there are a lot of people who have hypertension around us, but is it really newsworthy? Those are the questions that we faced when we initially started work in Punjab. Is it really newsworthy? Why is it such a big crisis? So it really fell upon this team to create that narrative. And we'll just look at a few ways in which it became possible. Next slide. So just today, we'll look at the factors of success. What was the recipe for this really successful media advocacy campaign? And of course, the various ways in which we engaged with the media. Next slide. When you look at the mediascape, and particularly in the last 2 years, which has been hugely impacted by COVID, and those of us who understand the challenges, because we relied 100% on earned media. It was not as if we were sort of advertising or we were kind of putting advertorials. We were relying on journalists to take an interest on the issue, go back and write their piece. Or when we were releasing a press, sort of a press note, we were sort of our success factor was basically how interested the journalist was in covering that issue. So that's why for such a big challenge, we have listed a few drivers of success. One, of course, primarily the partnership with the government of Punjab. Unwavering support right from the start. And we've heard a lot about it today evening. And I think that really was a unique aspect of the whole campaign here. Because usually in a policy campaign, in a system strengthening media campaign, the target audience is the government. But here it was unique because, yes, the target audience was the government, but we were also working in partnership with it. We had an insider view as to what were the impediments, what were the barriers, and what else could be done, what were the solutions that could be brought about to help the processes. And all of that we were reflecting in our media work. And then, of course, goes without saying, the leadership of PGI-MER. I think the content expertise, the technical expertise that was already there in the team, that went a long way. And I have to say that it was not just about the technical expertise or the clinical expertise, but also the fact that the community medicine team, they were so willing to become true blue media advocates. So I really want to congratulate them for that, for that creative approach and for wanting to do this. In fact, I know that there were sessions where the department has held, where we have talked about how doctors can have a greater role to play in the whole media advocacy piece. Then, of course, the fantastic influencer network, glimpses of which we saw, the technical support that was available from GHAI. So these, I think, were really a combination of these led to an impactful campaign. Next slide, please. And just a final glimpse at what really was the perfect recipe. I think beginning of the year and beginning of every month, we would sit down and curate media moments. And that was not easy to do, because how many times can you talk about hypertension? How many times can you make hypertension newsworthy? What are the various angles or newer angles in which you can look at hypertension? But the surprise is that we actually, when we put our heads together, we actually found so many ways of looking at that issue. I mean, be it from availability of drugs, the role of health and wellness centers, which Dr. Arif talked about. I mean, there was just so much of creativity that was possible because there was so much of innovations that was already happening at the state. Next slide, please. And of course, the partnership with the media, which of course, in case of media advocacy, just as the government or other influencers are a target audience, the media is also, for us, the media is a target audience. It is how we engage with the media. And I think the PGI-MER team has done a wonderful job because there has been so much of energy in building those media relationships. We've had quarterly and periodic media workshops, a lot of capacity building, be it technical capacity building of media, right from the first media workshop that we had 2.5 years ago, where experts came on board and talked about hypertension as a health crisis and introduced the issue, as it were, or TFA for that matter, to, of course, sharing regular information, the newsletter that went out. So overall, I think, including the photo here is from an event that was taking place at the PGI Chandigarh, at the Chandigarh Press Club. So even just that, holding these events, not just in the PGI auditorium, because usually when PGI-MER invites the media, they turn up and they turn up in large numbers. So, I mean, we've actually been through quite a roller coaster post-COVID, switching to the virtual mode, but managed to keep the entire media community very well engaged. Next, please. Just a glimpse of a few headlines, which we can scroll through. Next, please. Yeah, this again is just really some of the strategies of engagement, how we shared data and story ideas, and through a mix of earned media and social media, kept the engagement alive. So I'll just skip this part. Next slide, please. and again, a few glimpses of social media. I really want to congratulate the PGI team for, you started the new handle. I mean, and the new page dedicated to cardiovascular health. And I think it has been such a colorful social media campaign. Your pages, I hope, we will keep those pages alive, because it has the resource center, the virtual resource center, and the social media pages have now become a very important asset. So with that, I conclude, and congratulations again. I would be happy to take any questions if there are.
Thanks, Lopa, for a very interesting and informative presentation. And I must tell you that regular follow-ups and review at your end allowed us to plan media activities very strategically, and it proved to be a fruitful by the end of the day. Thank you so much, Lopa.
As you all know, that one of the pillars of our project was the advancement of operational research on hypertension. Dr. Sonu Goyal, Professor, Department of Community Medicine and School of Public Health, PGIMR Chandigarh, would throw some light on advancing operational research in hypertension. We welcome you, sir.
Thank you, Saurav. So PGI is actually known for research and clinical practice primarily. So we tried to inculcate the flavor of research in this second phase of the project. So what we did is, towards the second phase of second grant, we had an open call for writing manuscripts. So we thought of using the NFHS data on writing manuscript, and luckily and interestingly, we received 100 applications from 100 institutes of the country. And among them, primarily the people from AIMS, JIPMER, and all the Institute of National Excellence applied for it. We offered them 50,000 in case the article is published, and that money will directly go to the editor, the publishers of the journal as a publication fees. And rest of the money, in case the journal has a higher fees, so that money will be paid jointly by the authors. And if the money is less than 50,000, so we pay the same amount, like 20,000 or 30,000. So what we did is, we received 100 application, and then we asked them to write a concept note from all 100 people. And we screened the concept note from people, and we found that 30 primary authors, 30 institute wrote very clearly the concept note. Their research idea was excellent, and we selected them under this program. Thereafter, after this, can we move to the next slide? So after this, we developed a manuscript writing model in which we allotted one mentor with 4 participants. So in fact, what we did is, we developed a team of an institute, and we gave them a OR mentor. And how we selected a OR mentor? So a union, the International Union Against TB and Lung Diseases, conducts regular workshops, operational research workshop, and I have been a mentor since 2011 in them. So after that, there were a lot of mentors which are mentoring the research program under International Union. So and they kindly agreed to be a reviewer for the articles, and give the suggestion to people to write the manuscript and to review them. And we have a OR mentor. From PGI, we selected one person as a PGI reviewer. So we have a double level of reviewership, so that whenever this is communicated to a journal, so there is a chance of acceptance to the journal. Next, please. Can we move to the next slide? So you can see that after that rigorous exercise, we conducted a training also for all the people when they were towards the end of writing the research paper, how to actually put the paper into the journal. So we conducted a one-day workshop in which all the mentors who are mentors were there, all the PGI mentors were all the
Nidhi, I think you can continue.
Yes, sir. Yes, sir. There's some technical nag.
Yeah, there's a technical glitch. Yeah.
Yes, sir.
You can continue.
Continuing to what Dr. Sonu said, that we conducted one capacity building workshop for all the participants in which they were trained regarding the how to write a research paper and what steps are they supposed to follow, and where the OR mentors would help them, and the various deadlines that they need to follow for the submission of the manuscripts. I think sir has joined again.
You can continue, Nidhi. I think you can continue. Yeah.
Yes, sir. So the post workshop, all the participants, the various OR mentors, we were successful in collaborating with 9 OR mentors, and each OR mentor were given around 3 to 4 participants along with their other teammates, who worked with them from the inception of the manuscript and reframing it, revising it. And during the second phase, when the first draft of the manuscript was submitted, then a group of experts from PGI, it was formed to peer review the manuscripts. And these group of experts, they supported in terms of flag check of the manuscripts, and then revision of the manuscripts, and then final submission of the manuscripts in the recommended journals from the participants. And as you can see that after advocating with various journals, we were successful in collaborating with the Journal of Family Medicine and Primary Care, who have accepted our proposal of publishing a special issue on hypertension. And these 15 manuscripts that have been that you can see on this slide, they have been accepted for publication in this journal, along with one guest editorial from Dr. L. Swasti Charan. And we are also preparing one publication relating to the process of our operational research model, and it will also be published in the journal. And the other 15 journals, they are being submitted in very high impact factor and peer reviewed journals. And I would like to congratulate the team that our one paper has been accepted in the Journal of Public Health with the impact factor of 2.5. So this, you can see that this operational research model is a very cost-effective model in which we could collaborate with the hello?
Yes, Nidhi, yes.
Yes. So the model success is proved by its cost-effective approach and development of 30 high-quality research articles for promoting the hypertension control and prevention. And I think Dr. Sonu wants to add something to it. Hello?
So thank you, Nidhi. I think you have summarized what we are about to say. So we have around 30 manuscripts from this 1 year. So I think it itself is a good project in which we could publish 15 in a journal, and 15 are yet to be published. So this is another achievement which we have not thought about in this phase, as Vanna has rightly told, but we could accomplish this. And besides this, we have papers which were published out of this project. I think this is besides this advanced hypertension operational research program. So thank you.
Thank you, sir. Thank you so much. People influence people. Nothing influences people more than a recommendation from a trusted source. A trusted referral influences people more than the best broadcast message. So through our project, we have tried to frame few component-wise recommendations which could be useful in supporting the state's programmatic initiatives in the prevention and control of hypertension. For this, I would like to invite Dr. Punam Khanna, who is co-investigator of this project, and she is the Associate Professor of Nutrition in the Department of Community Medicine and School of Public Health, PGI. She is a technical expert for State Center of Excellence in Advanced Research on Anemia Control under Anemia Mukt Haryana. She is representative of PGI for conducting food safety training and certification FOSTEC in association with FSSAI. She is actively monitoring various nutrition programs such as ICDS, midday meal and village health, sanitation and nutrition committees in Punjab, Haryana and Chandigarh, and has contributed in various research articles in the field of nutrition nationally and internationally. I welcome you, ma'am.
Thank you, Nidhi. First of all, am I audible?
Yes, ma'am.
Okay, greetings everyone. Feeling honored to give recommendations on the behalf of SMHS project team. We all know we have successfully completed the innings, and it's a proud closing ceremony of the project. For this, all stakeholders and background players needs to be thanked. So I will start with first component, hypertension and cardiovascular health. State NCD committee may be constituted at state and district level to monitor the implementation of NPCDS program with focus on control of preventable risk factors. Initiation of proactive screening for hypertension by organizing special camps and ensuring availability of medicines in NCD clinics and health and wellness centers. Streamlining of hypertension protocol drugs in the state of Punjab, creating hypertension expert networks for prioritizing and conducting multi-state operational research on hypertension diagnosis, management, and services. Building capacity of state and district program managers through organization of online course on cardiovascular health. Integration of NCD program with the various ongoing vertical programs such as National Tobacco Control Program, National Mental Health Program, etc. Lastly, Ayush, to be actively involved in management of hypertension, especially by popularizing yoga and meditation. Our next component is health and wellness centers. For this, we need to advance the outreach activities of health and wellness centers to provide NCD care services at the community and household level. Regular screening and diagnosis of all OPD patients for hypertension and diabetes. Ensure the uninterrupted supply and availability of medicines, and health and wellness centers should be merged with the eSanjeevani portal. And for transfer regulation at the state and district level, we need to streamline and mainstream the trans fat regulation from 3% to 2%. And there is a need to strictly implement trans fat surveillance in the state of Punjab. Trans-fat-free schools, that is also an important agenda, and we need to continue this activity in schools as well, because they are the future, students are the future of nations. So we need to monitor the strict implementation of Food Safety and Standard Authority of India guidelines, that is restriction in sale of high trans fat, high sodium and high sugar HFSS products, especially near the educational institutes. And there is a need for advocacy for front of package labeling on the packaged foods. And we need to ensure the adherence to labeling guidelines for trans fats on the food products. And this is really very important. Recommendations and Media House and Department of Public Relations, they play a significant role when we come up with any campaign, or we come up with any research or some strategy. So media need to be engaged for wider dissemination of awareness about hypertension and its related comorbidities. So we need more emphasis on social media, and Public Relations Department in collaboration with the Health Department should organize the capacity building workshops for the media personals and journalists. Lastly, local media houses should be involved while planning and execution of the health awareness activities at the block and district level. With this, I say thank you to all of you. Thanks. Dr. Nidhi, over to you.
Thank you, ma'am, for enumerating the drafted recommendations of the project. And these achievements could not have been possible without the efforts of our dedicated team, comprising of our principal investigator, Dr. Sonu Goel, and Saurabh, Kritika, Mahinder, Radhika. And we are lucky to have co-investigators of the project, Dr. Ashok Kumar, who is a professor of Department of Hospital Administration, PGI Chandigarh, Dr. Poonam Khanna, Associate Professor, Department of Community Medicine, and Dr. Kadirwal, he is an Assistant Professor of Department of Community Medicine. So thank you all for all your support and efforts, timeless efforts in making this workshop a success. Now I would like to invite Mr. Arun Verma, who is Director Finance and Operations, Cypher Chandigarh, to deliver a vote of thanks. And Mr. Saurabh, you please introduce Mr. Arun Verma.
Arun Verma, sir, he is an electrical engineer by profession, having master degree in power system. He is a fellow of Institution of Engineers and fellow of Indian Council of Arbitration. He is an alumni of Johns Hopkins School of Public Health, USA, formerly Director, Distribution, Public State Power Corporation, Director, UHBVN, Director, HVPN, Director, HPGC, CG, and Managing Director of Dakshin Haryana Power Corporation. He was invited by the World Bank to share his experience in sizable reduction of carbon footprint through introduction of high voltage distribution system in agriculture sector in the state of Punjab. I welcome you, sir.
Arun sir, you are mute. Hello.
Yeah, thank you. Thank you, Mr. Saurabh. Good evening and greetings to one and all. It is my proud privilege to propose a vote of thanks on behalf of the organizers of National Dissemination Workshop on SMHSP, strengthening the management and hypertension services, the flagship program of GHAI. As Dr. Rakesh Gupta has shared with you that our chief guest for today, Honorable CM Punjab, has expressed his inability to join because of the very, very busy election schedule, but he has conveyed his best wishes and blessings to the organizing team for the success of today's workshop. So I start my duty by sincerely thanking our honorable guest of honor, Dr. Sudarshan Mandal, Deputy Director General, Ministry of Health, Family Welfare, Government of India. As well, I would like to thank Dr. Raj Kamal Chaudhary, IS, Principal Secretary, Health and Family Welfare, Government of Punjab, though he could not join due to sudden and unforeseen occupation. I wish to extend my sincere gratitude to our special guest of the day, Dr. Vandana Shah, Regional Director of South Asia Programs, CTFK, GHAI. I am extremely grateful to our honorable speakers, Dr. Arneet Kaur, Director NHM Punjab, Dr. Sandeep Gill, who is Assistant Director and State Nodal Officer, Director Health Services Punjab, Ms. Lopa Ghosh, Country Media Coordinator, GHAI. I congratulate and thank the organizing team, Dr. Sonu Goyal, Professor, Department of Community Medicine and School of Public Health, PJMR, Dr. Rakesh Gupta, President, Cypher, Dr. Poonam Khanna, Associate Professor of Nutrition, Department of Community Medicine and School of Public Health, Dr. Om P. Vera, Country Coordinator, India, GHAI, Dr. Nidhi Jaiswal, Technical Officer, Hypertension Program, Department of Community Medicine and School of Public Health, Dr. Kritika, Dr. Radhika Rana, Dr. Anupam Patni. I also thank Dr. Gurmandeep Singh, Dr. Sukhveer, Dr. Anupam, Dr. Sanjay Pandey, and Dr. Balyal for joining the workshop today. My thanks are also due to our backend team, Dr. Mehndra and Dr. Saurabh, who have made a lot of contribution for organizing the event. Thank you one and all. Over to Dr. Nidhi.
Thank you all for joining us today. Sir, Dr. Sonu, any last words to share?
No, actually, it was actually great to shift the time in the evening, where we could find Ms. Vandana Shah and the people from ministry. I think this is the time where we can all we are relatively free as compared to our morning time. And it was a great project, great collaboration, and I would cherish this collaboration and look forward to collaborating with everyone. And my wishes to my staff who had done excellent work. So it was due to all of them, Nidhi, Kritika, and Saurabh, Mahender, and Radhika. So I think all of them did a wonderful job. Arshdeep, because he was there with us before Dr. Mahindra. So they did wonderful job. And again, our collaborators, Dr. Poonam, Dr. Ashok, and Cypher, Arunji, and Dr. Rakesh for collaborating with us and making this endeavor a great endeavor. So thank you, all of you. And we look forward to meeting soon, I think, in next year. Thank you very much.
Thank
Bye,
you.
everyone, and have a very good evening to all of you.
Thank you.
Okay, thank you so much. Thank you so
Thank you,
much.
Dr. Goel. Thank you, everyone.
Next year, 6 January.
Thank you.
Thank you so much.
Thank you. Thank you all. Thank you.
Thank you all.
Thank you.